If you are looking for a proton therapy system which will cost you significantly less than systems in the market, enable you to treat every site of the body and some sites better than gastric-based system, and enable you to do adaptive therapy the way you want to do it without the time spent on doing it, PQ system is the only system in the market that enable you to do all of these things together.
PQ really did look at what are the requirements of proton radiotherapy and did not just simply copy existing techniques, appropriate or not, from photon radiotherapy, because clearly, again, proton radiotherapy requirements exceed or go beyond those requirements of photon radiotherapy. So what PQ achieved was a tightly integrated system, including a CT scanner so that we can get diagnostic imaging, software that assesses the geometry of the patient, can assess the dose of the patient, and if necessary, adjust the beam parameters to bring the dose that will be delivered in the patient in compliance with the intended dose.
PQ treating in seated position could be an advantage in some cases, especially if combined and integrated with new technology to stabilize the moving target, such in lung and liver, that was developed in Sheba Medical Center.
The clinical advantages of the PQ solution are, first of all, that you can have onboard imaging with a CT in the treatment position, which is obviously an advantage for accuracy of treatment when you're looking to treat to the closest millimeter, which you often are for brain tumors, head and neck tumors, and many other sites where we now know that the toxicity to organs around the tumor is greater in some cases than we thought before. So I see the PQ solution as being ideal for brain tumors and head and neck tumors, both sites where we get close to the dose limitations when we're treating many tumors, primary tumors or metastatic tumors in the brain. Another possible advantage for lung cancer patients is that in the sitting position, which is the position which PQ treats patients, probably there is less dose to the lung relative to the tumor, to the target, than there is with the patient lying down.
Adaptive therapy is crucial in proton therapy since this technology is based on break peak, and break peak is absolutely depending on the proton energy and the beam path. So any difference between simulation planning and delivery can cause a 100% error that instead hitting the target, you can hit healthy tissue or organ at risk. In PQ solution, the presence of a diagnostic CT in the treatment room allowing a real adaptive treatment for perfect match between simulation, planning, and delivery.
The PQ solution has two great advantages. The first is cost. The main impediment to incorporating proton therapy machines in most treatment centers is the cost. With a PQ therapy, there's no need for a large room. We can have a gantry allowing with pencil beam scanning, proton beam in a relatively small room, often rooms which exist in existing facilities without having to build something new. And this will allow many more centers to incorporate proton therapy as an option for the treatment of their patients.
This is a huge advantage because the footprint is so much smaller, the cost of the equipment and the construction is only a fraction of what you can do with a gantry, but still you can do everything that you can do with gantry with regard to the treatment of body site, and in many sites it's actually a better treatment.
It's a good enabling technology to make proton radiotherapy accessible to more centers, and it's really the necessary technology to really operate a proton radiotherapy clinic.
Once you've achieved a higher level of safety, you can also get to a higher level of efficacy because you can do dose escalation, or you can do hypofractionation, larger doses per fraction, and even ablative radiation much more safely than you can do without the accurate imaging as the final stop. This is particularly important for brain tumours and head and neck tumours, where the PQR solution is an ideal because easily the patient in the treatment position can be scanned and can be treated without any change in his position, and he can be immobilized like he can for any other kind of radiation therapy. My vision of the future of radiotherapy is that the cost of proton therapy will eventually come down to be not much more than the cost of photon therapy, and every major cancer and radiotherapy centre will be able to offer proton therapy to all its patients and where there is an inherent advantage. The PQR solution, which moves the cost of the gantry and the size of the large room needed to house the gantry, makes the possibility of putting proton therapy in a relatively small size room. Many of the centres have rooms this size already today. Again, because the gantry is smaller, the cost of the whole machine is going to be much, much lower, and the cost of the source of the proton beam is coming down as well. And all these things together will eventually, within a few years, I hope, maybe in the lifetime of my career, to be able to see that proton beam therapy will become a standard therapy in all major cancer centres.
The only practical technology, practical way that we can see in the horizon that will enable to reduce significantly the cost of a brand new proton therapy system compared to all the systems in the market is a gantry-less system, and the only one that is available and will be available in the visible future is the PQ system that not only enable you to treat patient in a sitting position, keep the footprint much smaller, make the construction less expensive, but also integrate the horizontal CT above the treatment chair, which also upgrades significantly the ability to do adaptive therapy in real time.
Here at the Chicago Proton Center, we have all of these innovative means of delivering proton radiation therapy that allow us to treat patients to the best of our ability and ultimately improve their outcomes.
We find ways to do the treatment in the best possible way. So we're always looking for ways to improve things. The vertical CT scan allows us to treat patients in the seated position. Most CT scanners are done with the patient laying down on a table, but for certain parts of the body, especially right in here, sitting in the chair makes a big difference.
With the vertical CT scanner, this allows us to treat lung cancers, lymphoma, esophageal cancers. Certain head and neck tumors may also be served well in this particular treatment room.
Our patients will be seated in the chair here, and this chair is used not only for that scan, but because it's on the robotic arm here, it can also move the patient into the treatment position so that they can be treated with proton therapy. The primary ways that this will be better for some patients with lung disease, it's very hard for them to lay flat on their back. So in the seated position, they feel much more comfortable. It's much easier to set them up in a consistent way and to be able to do the treatment each day. The second is that the lung stretches when you sit up, and so that pulls away more of the normal tissue from the area that we're trying to treat.
This is important because when we are delivering radiation therapy, we are trying to give high doses of radiation to cancer and minimize dose everywhere else. If we are able to visualize the cancer in the treatment position before every single treatment, it allows us to reduce exposure to non-target sites.
We have very few proton centers in the country, but even those centers don't have this type of equipment. With technology like this, we're now curing those patients with fewer and fewer side effects, so their quality of life is better.
The vertical CT scanner is really something that we have pioneered. There's no doubt that this is cutting-edge treatment. Myself, as well as my colleagues, are very excited to provide this to the community.